Welcome back to another episode of Time Out with the Sports Doctor podcast. I thank you for continuing to support me in all of my endeavors. Last time we shared my 10-minute speech from the Next Level Speakers Academy, and I've received so much great feedback from you, and that's really appreciated. You know, a little sensitive when you release your first speech or when you release anything really in front of people. So I really appreciate the support and the feedback. Many ways I've been able to receive value from this podcast in many ways. And many times when you think about getting paid from a podcast, you think about monetary. One of the greatest benefits from this podcast is being able to not only represent myself, but represent my family and represent a lot of the people who have supported me along the way. And one of the greatest things about that last episode was hearing from my grandmother and hearing the pride in her voice and the joy from her being able to hear me share my story and honor not only her, but my late grandfather, and honor my family and all the things that I had to overcome to achieve the level of success that I've achieved so far. So that's just another way, another benefit of sharing your story, because not only do you uplift others, but you know, it's another way of validating who you are and all the things that you had to overcome to get to where you are now. So I just wanted to encourage someone who might be sitting on your story or might be a little scared even to share your story or to put yourself out there in that way. But it can not only help you grow, but it can also help others around you. And this week, I'll be sharing with you an interview that I did on another, not podcast. It is a podcast, but it's also a live radio show in Mississippi weekly. So I was able to join Rebecca Turner on her Good Things podcast or Good Things show. And it was a very candid conversation about sports medicine. So I got to put on my orthopedic surgeon hat this week. And we talk about a lot of pertinent things about returning to school and sports and healthy lifestyle. So I think it will be really beneficial to each person that listens. So I want to share this episode with you. And just thank you for continuing to support us. I always appreciate your feedback, any ideas that you have, any guests that you think would be good on this show. Thank you. Any guests that you think would be good on this show, I'm very open to hearing from you. So thank you to continue to support us. Remember, we're doing bi-weekly episodes now. So take this opportunity to go back and listen to some old episodes. And we're coming up with some compilation episodes for you soon. So be on the lookout for that. Have a great week.
So we have with us today Dr. Derrick Burgess. He's a board-certified orthopedic surgeon, sports medicine specialist, and assistant professor at the University of Mississippi Medical Center. A lot of other cool things he has. We'll get to that in a little bit, but he's here to sort of help us out. So welcome, Dr. Burgess.
Glad to be here. Thank you for having me.
You know, it's so timely because I have a seventh grader who just started cross country for the very first time, and getting out there and trying something new, which when you think of kids running, it's part of just what they do. They get out and run about. But it's not intentional running, right, in terms of like long miles. And we started to have some of these aches and pains we weren't necessarily used to. And I thought, man, other parents or other kids must go through these kinds of things too. So it's not just football, baseball, basketball, soccer, a wide array of sports kids can find themselves with. I hate to use the word injury, but how do you sort of describe it, Dr. Burgess?
Injuries, pain, just, pain, really. Sometimes it's pain that you have to figure out, is it an injury or is it overuse or is it just something that they're going to get over as they get used to their sport?
So as within your clinic and your profession, do y'all look at fall as kind of like the busy season?
So fall is definitely a busy season because of football with the amount of kids playing that one sport. But as you mentioned, you can't ignore that you have cross country going on. Some schools are playing softball. The females are playing softball right now. Have basketball gearing up, which never ends. Volleyball is also going on. So we have a lot of different sports. The spring is busy, but the fall is very busy as well.
Let's talk with football. It's the big one.
Right.
And obviously people see the athletic trainers and things on, the sidelines on Friday nights. But they have been leading up to this. Maybe they had their summer kind of off, but then they get back into camp and they're just really ramping kind of up. What are some of those more common things that you guys start to see in your clinic this time of year, at least around like those major sports like football?
So especially with football right now in Mississippi, heat exhaustion or dealing with the heat. Good thing for the football players, they've been dealing with it all summer. But now you have some people who didn't train for cross country, who decided to do it when they got back to school, and now they're dealing with that same heat. So we have a lot of eyes on football. We have trainers at practice. We have trainers at the games. a lot of these other athletes are kind of on their own to some extent, unless they're injured. So we always have to worry about the heat. We always worry about overuse injuries, so to speak, for people who might have been playing on different teams all summer. Now they're coming back playing on another team. Do they have sprains or just overuse of young kids? We're worried about their physis, their growth plates. Sometimes from the stress, they can have injuries to their growth plates. So a lot of different things that were going on. So it comes in as pain, and it's up to me to figure out, is
asking
it really,
those good questions.
Right, is it serious, or is this something that we can take a little anti-inflammatory and then get back to it?
So you mentioned the heat, so that just made me think. I was listening to Sports Talk, but this was several weeks ago, and they got in this big discussion about wet bulb. Am I saying it correctly?
Wet bulb.
Well, or something, and we definitely don't have to go into the science of that. But for the most part, at least Mississippi public school districts, Dr. Burgess, do they do a good job of at least having these benchmarks now in place for dealing with the heat and when to take practices inside or limit practice exposure outside? Are we trying to do better in that respect?
And it takes into account more than just the temperature. It has humidity and different other factors that are all going into that score or index. And when it's above a certain level, when it's in the yellow or red, it tells you what you have to do as far as limiting exposure for the athletes. So some days you can't go out at all. Some days you might have to go out for a shorter period of time. Some days you might not be able to be fully dressed for football, but it definitely does help.
And then the nice fall break comes and you're like, I have lungs. I can breathe. Where did this sort of come from? But that doesn't stop just a particular injury. You can have those that just sort of creep up through the time. Talk about pain, Dr. Burgess, because, again, with my, 12-year-old who started to have a little bit of knee, I would say, issues, what her hurt is and what I'm thinking, like, what's that pain scale? I'm not going to say you don't know how to trust your kids. You should always trust your kids if they tell you something's hurting.
Right.
But to the point of needing to make a doctor's appointment, needing to come, to take you in, how do you help parents navigate the pain word?
Yeah. So pain is difficult to assess or measure. So we have some pain scales that we go by. And just last week, I had a parent upset when their kid said they had 7 out of 10 pain. And mom was like, absolutely not. You don't have 7 out of 10 pain.
So me, I would do that.
But at the same time, I lean on the parents to say, how much pain is this child having? Are they actually limping around the house? Are they avoiding activities they like to do? Are they complaining every day when they come home from school? Because sometimes they'll say 7 or 8 out of 10, and I'm saying, okay, but you're smiling, you're going about school, you're still practicing. Is it that severe? So in your pain and my pain level or score are going to be completely different. So I think outside of just saying, what's your pain, 1 to 10? Oh, it's about a 6. It's about an 8. I like to ask more pointed questions about, are they having pain at rest? Are they having pain just from going through the normal daily activities? Does it only hurt after practice, or does it hurt during practice? So when does the pain occur? Does the kid still do things that they like to do outside of maybe that activity that they're not really fond of? Right.
Nah.
So are you still able to run around and flip even though you can't go to practice?
Right.
So things like that really are helpful for me to know, how bad is this? And, when I come in and I see someone who I know they love their sport and they're not able to do it, and they say, you know what, I need some time off, that really keys me in to say, okay, this might be something serious.
Dr. Burgess, what about swelling? Is that one of those telltale signs that maybe, that there's something that should be, seen about?
Yeah, so if you have pain, bruising, swelling, in addition to the pain, so if you're having swelling, if you're having some bruising of that area, that's something that we really need to get you in to get some imaging, maybe an x-ray or an MRI might be needed to show that, hey, there's something else really going on. So pain in addition to swelling, inability to ambulate, bruising, those are things that we're really concerned about.
When should we bring in our child? I know this is, you work with a lot of high schools here in Mississippi. I know even for Rankin County, at least Brandon, they have athletic trainers on staff, which not all school districts have that opportunity. So when should a parent think, okay, I need to take off work, I need to take in, and do we go to the Trust Cares, the MEAs type clinics, or do we go to more specific places for those particular things because it's not like fevers, runny nose, that kind of stuff?
Yeah, great question, and it's complicated because sometimes right away, this is severe enough, I need to go to the emergency room. I don't even need to take my kid home tonight. I need to take them to the emergency room. That's very rare. Most of the time, they're going to complain to you probably several days, maybe weeks before you really start to listen to them. So I think if you see that the kid cannot put weight on whatever extremity, if it's upper extremity, if they have excessive swelling, if they have bruising, those are things they're saying, okay, this probably needs to be seen sooner than later. Now, if they fall and have just a little pain and it doesn't, no deformity, not a lot of swelling, not any bruising, and you say, hey, I want to monitor this for 3 to 5 days, and they're still able to walk or still able to put weight on that extremity, that's reasonable in most cases. Now, you might still be missing a very small fracture or an injury, but most of the time, if you don't see some of those things that I've listed, if you wait 3 to 4 days and you're doing ice or giving them Tylenol or anti-inflammatory medication, and that pain continues to linger, that's when you need to be seen.
One of the best things, too, for parents who have kids like mine, or at least my daughter, is don't ask. 'Cause if they bring it up to you,
sure,
then maybe there's still something going on. But if you wake up in the morning, you're like, hey, honey, how's your knee?
Yes.
Oh, mommy, it hurts. So,
and parents are smart, right?
Yeah.
So you have to observe.
Sometimes.
Right. You need to observe your kids when they don't know you're observing them.
Yes.
And that tells you a lot. Now, as far as who do you need to see first, sometimes it's who do you have access to the quickest. With some insurances, they won't let you see me unless you've seen your pediatrician or whoever your primary care provider is. So you might have to go see that nurse practitioner or pediatrician or go to one of the urgent care centers to get the initial treatment and then be referred to me. Some insurances you can come right to me right away. So
that would be a conversation I guess you would always first have with your pediatrician, and they would
Absolutely.
probably let you know, because they also don't want you having to come in if you don't necessarily have to do that. I guess you've had a lot of experience when it comes to many different young athletes, middle-of-the-road athletes, and all of the above. On our text line, though, before we get away, Dwayne from Brandon asked Dr. Burgess, his son tore his ACL, number one, very sorry, Dwayne.
Yes.
There was a doctor on site to evaluate his injury. He was curious if you ever go to games. And I know you may be more metro. You can't be everywhere. But are there people like you everywhere?
Sure. Well, not everywhere, but I've been going to games. I was at a game last Friday talking to a high school athlete who was helping out. He was helping out with the trainer. And I started counting back. I've been on the sideline for almost 20 years now, going back to even med school. So that's something that I really enjoy, because being on the sideline, you get to see that injury happen and you get to assess the athlete and talk to them right away. Sometimes that might be the best time to examine them before they start swelling and getting stiff. So it's a luxury really to have a physician on the sideline. Many times you will have a trainer. Most schools in this area will have a trainer. Sometimes they'll be covered by a nurse practitioner, but some of the high schools are fortunate enough to have a physician to actually be at the game. Many times they're not. Some high schools around here don't even have an athletic trainer to cover the team. So I think that at a minimum, the athletes deserve that, because you never know when an injury is going to happen. And sometimes it can be a life-threatening situation that you have to act to pretty quickly.
Well, that was, and I don't know my years there in the NFL where the athletic trainers were able to help the player with CPR and sort of, so you just never know. It's not always just in terms of the sport itself. Sometimes there's just something brewing there as well. Is it due to just funding that usually you don't have an athletic trainer at every game? Is that kind of?
So I think a lot of times it's resources, funding. Sometimes there's a shortage of trainers, just like there's a shortage of healthcare providers. So many times we have one trainer covering multiple schools or multiple sports. So it's hard to have someone at each event.
I get that. Keith and Meridian, I get your mom too. My mom was tough with 3 boys. If you were not bleeding or limping, you get those muddy boots out of here and wrestle the dog. And I think that goes back to parents understanding their children very well. It's like you were sort of saying, Dr. Burgess. I feel like, Keith, if you had a bone sticking out, your mom probably would have moved forward with that. Scott and Clinton wants you, Dr. Burgess, to sort of talk about signs of concussion, which I know is kind of gearing in a different way.
Yeah.
So we're talking about Friday night and sort of sports, and yes, concussions is part of that, but we can take that broader to, kids playing outside, things can happen, falls, if you're roughhousing or anything like that. So I think even just parents or grandparents having the knowledge of what to look for with that, because am I correct, that can happen with any sort of forceful impact with the head? Yeah,
I've had my child suffer a concussion from falling down the steps. So we think about it with football, but we also see it in soccer from heading balls. We see it in basketball. You go up for a layup, somebody takes you out, you hit your head against the court. So anytime that you have a hard collision, you can have a concussion. Car wrecks. So many times it's missed after a car wreck. You come in and you're treated for whatever is hurting you, and then I'll see you a couple of weeks and you say, man, I've had a hard time sleeping. The lights and loud noises are still bothering me. And that clues me in that, hey, you probably had a concussion and you're still having some effects. So some of the things that we look out for, especially in sporting events, if you see a hard collision, somebody needs to check out those athletes. You don't need for the athlete to have to come over to you and say, I'm not feeling well. Someone should be assessing that athlete right away. So any change in consciousness, if they have loss of consciousness, that's very important. But if they have a hard time concentrating, if they have blurry vision, if they have a hard time following commands, or if you see them, sometimes they'll see a hard lick and they get up and go to the other team's sideline instead of going to their huddle. And many times it's another player that'll see them in the huddle and they're just not right.
Right.
Somebody needs to say something. It doesn't have to be the trainer. It doesn't have to be the coach. It doesn't have to be the player. Anyone that observes the athlete with anything.
Would that be an emergency
altered.
room immediately kind of
So
thing?
that needs to be, they need to be assessed by whoever's there, the trainer from your team, or many times you're going to have a trainer from the, if you're visiting another team, they'll have a trainer even if you don't. So very rarely do you have to go to the emergency room and have like a CT scan or something of that nature done, but you do need to be assessed by a professional, an athletic trainer, a physical therapist, a physician of some sort, or a nurse practitioner.
And probably not go back on the field for a minute?
Absolutely not go. So when we were in school, it used to be the 15-minute rule. So it was really complicated. If you had loss of consciousness or if you had a headache, you were reassessed in 15 minutes. If you were clear, you could go back. Now it's really simple. If you have any of those signs that we talked about, you're done for the night. So, and many times the kids will know that, so they'll try to hide the symptoms. Mm-hmm. But it's really easy now. If you observe any of that, remove them from play, and they're out until they're assessed by a medical professional.
You mentioned Dr. Burgess talking about if you had a car wreck or something completely different. Is it still important to know that you ever had one? Does that need to go in like your medical file and sort of history? Because, even though you recover and you feel fine, down the road, could it be linked to or just need to know for your information?
Sure, absolutely. Because the second impact syndrome is something that we really worry about, especially if you had a concussion this week, nobody diagnosed it, and you're back out there next week. If you have a second concussion, it can be more severe and sometimes even lethal. So the amount of concussions, we don't have a definite number as to say if you had 3 or 5, then you should stop your sport, but we should definitely be having that conversation after you've had multiple concussions. As healthcare providers, we spend a large portion of our lives focused on our training as well as taking care of other individuals. But I'm calling a timeout because life can change in an instant. We know it's difficult to fathom that a sudden illness, injury, or death could put you and your family in a devastating financial situation. But that's where Dr. Stephanie Pearson and her unique team of advisors at Pearson Ravitz come into play. They focus on empowering physicians like yourself to protect your most valuable asset, your income, and life's most important people, your family. So go to pearsonravitz.com to make sure that you are protected today.
How do you discuss, or maybe parents don't discuss that with you, I guess they're not coming to see their orthopedic surgeon before their kid starts to play a sport.
Well, participation physicals, many times we talk about that.
And sort of having that, because you just feel like these are things, especially if they're playing multi-sports. If you've got a soccer player who's also going into football, I guess concussions can happen at any time. Yeah. But are these just things that parents just need to be aware of?
Yeah. And many times when you're doing your pre-participation physical, they should be asking, do you have a concussion history? Because many times the athlete forgets about it or they just don't talk about it unless somebody asks them. So many times I'll ask, I had one in 9th grade and then one in 12th grade. And now here you are as a college freshman and you've already had a history of multiple concussions. So you definitely, just because you got over it, doesn't mean that it doesn't still impact your future.
Is there anything parents leave out in physicals that you feel like they should share? Because I feel like if you've ever gone into one of those physicals, which if you play, I guess, in public schools, there is a requirement, which is
Correct.
good. But you can feel sometimes when you're going through them that it's just very through the motions. Is there something parents really should make sure that if they know about their own child, that should be on their physical?
Absolutely. So the thing that they can help us with the most is actually filling out the form. Because many times we're seeing 100 athletes at one time, and they're lined up all the way down the hall, and then they come and they don't have a form. So we're like, here, fill this form out. So now your 15-year-old or 13-year-old is filling out their medical history, family history, surgical history. So how great is that, right? So the main thing parents can help us with is doing that history part of it, because that's really important. That's
Do you
just
want like nuclear history, like your grandparents, or like maternal and paternal, or is it like my great grandmother died of something strange back in the 1900s?
So if we can get the immediate family, that's excellent. Many times we know we're not going to get grandparents and great grandparents, but if we know that dad and his uncle and his brother had heart disease and they all died in their 40s, that's very relevant.
Red flag.
you know, so big things, that's what we really need to know.
And I think even if they had lifestyle factors that led to that, still something about their heart had weakened to not be able to sort of sustain that. And that's just things that you just want to make sure that your coaches and that your trainers and that your athlete also knows, so they can pay more attention to their own heart or their own body's heart included in that. And if they feel like something's off, they can be more vocal and verbal about that.
Yeah. So as a screening is what the physical is, and it's only as good, really, many times as the history.
So, hey, that's something for us to...
lets us know what to really look out for.
And think about I think the most thing is, too, the trends in your family history is the thing that your physicians or orthopedic surgeons would need to know. It's just funny. It's like not the first thing I think to jump to. You feel like there's so many of these other things. Someone did ask, can you get a concussion from doing headers in soccer? So I know there's a lot of soccer parents listening. So absolutely.
No, you can definitely get headers. And what we know is the repetitive nature of the heading of the ball can actually have an impact on you as well. So think about it, when you're hitting the ball, somebody else is trying to hit it many times as well. So you can have that head-on collision as well from that.
And that's just things to keep in mind and keep track of. That's what I'm learning from as a mom who's got a young student athlete coming up, just starting out in the real sort of competitive part, just remembering the things you just need to remember in terms of making sure that they're well taken care of. And I had spoken earlier, 7th grader, she's 12, just started cross country. And I think what's common a lot, and you probably see that too, Dr. Burgess, is this idea of like knee pain. But that's not just in cross country. Any sport that requires them to run hills, run sprints, run 40s, I'm learning the new terminology, that they can feel like they have this knee pain. So that's common, right?
So one thing about knee pain is that it might be the knee, it might be the hip, it could be a combination of the two. So when I see or assess, especially a young athlete with knee pain, I want to look above and below. So if your daughter comes in and say, both of my knees hurt, I'm usually thinking of some form of tendonitis or something overuse. Now, at the same time, I'm going to examine her hips to make sure that it's not being referred from her hips. And I'm also going to check her strength, because young athletes, especially young females or young males, they haven't been in the weight room yet. Many times they haven't really even started maturity or puberty. So the muscle mass, we a lot of times have tall, lanky athletes. Mm-hmm. So they might have good endurance, but they don't have good strength. And think about cross country. You're running on different terrain. You're off street, on hilly roads or hilly countryside. It might be wet. You might slip. So it's easy to hurt yourself if you're not in good shape or if you're not strong. So I check their hips. I check their core. And many times that's where the deficit is. So they'll say, no, my knees hurt. And I say, okay, let's do some hip strengthening and some core strengthening, as well as treating the symptoms of your knees, and then you get better. And that keeps you from coming back.
And that's not like hardcore hitting the gym, squats at 12, although I guess teaches on, that it can be moderate things just a couple times a week to start intentional movements.
Yeah, so at 12, I'm telling your daughter, hey, do you know how to do wall sits? And if they do, they want to act like they don't, but we're going to do it together. So we're going to do wall sits. And I said, hey, let's do this 3 nights a week. You can do leg lifts to work on your core. You can do air squats. You don't need to load your spine with a lot of weight. You can do a lot of body weight things, and then work on stretching and strengthening. A lot of times we see tight hamstrings, weak hamstrings, weak quad muscles. So all of those things factor into the knee pains. It's not just something organically going on inside the knee.
So I hope parents or caregivers who are listening, obviously there's access and not everyone has the opportunity, but it feels like if you've got a student athlete who has nagging issues, if you can go through to get just to have the conversation so you can have that assessment and then something built. It doesn't feel like the stuff to fix it is very intense. It's just you need to know your individual sort of assessment to then bring it home and have that knowledge so you can have a healthier athlete throughout their middle school, senior, or maybe even college years. Does a lot of this change or shift, Dr. Burgess, once you get into community college or college post-graduation, higher education, sports?
So I think you have a lot more help at that point. So you're going to have trainers and you're going to have people working with nutrition, hopefully. But at this young age, that's when you're making those habits. So if somebody gets injured at 12 or 13 and I can really change their habits and change their approach to their sport, I think that's even more helpful than, if they get injured later on and they're already really set in their ways.
You said my favorite word, nutrition. Which oh my gosh, I could, give you a whole several hours on that. But from your perspective, and I know not necessarily knee injuries and ACL tears and concussions and stuff don't come from poor nutrition, but how important is it that a student at least has a baseline of decent nutrition to stay where they're staying injury-free?
It's very important. I stay on my middle school child about this all the time. You wake up and you don't really eat breakfast, and then you go to lunch and you don't like the lunch food, and then you go to practice. So you're running around for 2 hours with nothing. On Friday night, a kid just got over illness. I said, "What'd you eat for lunch?" "A hamburger." "What'd you eat pregame?" "Oh, I didn't want another hamburger, so I ate Skittles and Kit Kat."
Sounds delicious.
And playing running back in football. So
Came right back up.
So
yeah.
Nutrition is important.
Yeah. I wish, you talking about just in terms of access and all, I wish I could sit down with every, team or individual athlete and have those conversations, because it feels very overwhelming, just like I feel very overwhelmed, Dr. Burgess, with, some of the stretches or things going because it's not in my area, where other families feel that sort of way with nutrition. But I would say just making sure they're not drinking the things that that stimulates their heart and such, and then also just keeping them sort of fed. I'll go back to like a lot of parents, you think the energy drinks aren't a big deal, but they are when you have a student athletes, particularly if you do have a family history of AFib or like any sort of heart issues. I would just that accelerates the heart. So then you're going out there and accelerating the heart, and then they may be taking pre-workout without you knowing, and then we're accelerating the heart.
Absolutely.
And so it can asking your athlete what they're doing and just being a little bit more knowledgeable can be helpful with that.
And then you combine all these supplements with not drinking water. So then you go Monday through Thursday, don't drink any water. You drink a bottle before the game, and you think that you're going to make it through the game. You have to hydrate all week, especially in this hot weather that we have right now. My
favorite way of describing it, that kids and adults sometimes, because we're saying all this about student athletes, and I'm sitting here, Dr. Burgess, taking little notes for myself because, I appreciate that I'm one of those just mediocre midlife crisis athletes, sort of as well, and it bears well. All this information bears well to us also. But if you think about like a flash flood, why the water doesn't stay is because the ground doesn't have time to absorb the water as fast as it's falling, and it only has one place to go, and that's run off. So even if you have a student athlete who, particularly older ones, who may want to go out on Thursday night or Friday night or whatever it is, and wake up a little dehydrated, or they've heard, hey, you need to be hydrated for the game, and they think, oh, I can pound that and get hydrated quickly. It happens in their body just the way it does as it happens outside. Their body simply can't process that hydration quick enough, and the only other places for it to go are extracellular spaces, and that's scary.
Yes.
Very, really quickly. So, as much as we want them to stay hydrated, it has to be a slow, kind of, as you mentioned, throughout the week, on a daily basis. It's not, you can't, and you also at the same time, you can't, pound 5 apples and a beef stick and be well fueled either the night before the game. That is also sadly, it's a continual effort in that as well. So
I think one good question for you are, what are some in-game or pre-game snacks that will be good for athletes? Because many times they're at school and they already ate lunch, and then they don't like the pre-game meal. What are some good alternatives they can have?
So for, they don't like the pregame meal. Yeah. So usually when I'm working with a student athlete, first thing we talk about is eating throughout the day. So even if you miss one eating opportunity, it's not as the end of the world. So I love student athletes not going more than 4 hours without having something to eat. So even if we have that, 12 o'clock meal. If we missed that 4, it hasn't been 8 o'clock since we, sort of ate last. But you're looking for something that they'll enjoy, that's quick, obviously not high in fatty or anything that will come back up, but nothing that's going to spike their blood sugar too quickly. So like the Skittles. Now, if they would have done Skittles with like a mix of honey roasted peanuts, or done like a handful of almonds, like a trail mix with it, we might could get on board with that. And when you think about working with student athletes, you have to meet them where they're at.
Absolutely.
So it's like, if I can get you to have a Pop-Tart, but also maybe like a Propel water instead of your energy drink, that I'm going to pair those two together instead of saying, just no to sort of both of them. But I am more worried about you going home and having like a hot meal than worried about like down in a protein shake or something like that, right after you get done. It's that hot meal within a couple hours that's going to be the thing that's going to refuel you sort of the best. But really thinking about it, when you're in season, you're always in recovery. There's no sort of downtime sort of for that as well. It's a shift in mindset for both family and sort of student athlete to stay healthy.
Absolutely.
You do have your Friday night clinics. So if families find themselves in a pickle on Friday nights, and do clinics like this, are they popped up all throughout the state for this specific reason during this sort of season of football?
So I know that several clinics do exist. We have ours at the University Pavilion on the university campus. University of Mississippi Medical Center on Friday night from 9:30 to 11:30. You don't have to have an appointment. You can call ahead, especially if you go to one of the schools where our trainers, we're going to know about it. But we had a kid drive over from Louisiana a few weeks ago to be evaluated. So we can evaluate the patient at that point, the athlete. We can do any tests that we need to do, x-rays, things of that nature, and we can make a diagnosis, because many times making a diagnosis early, you can start treatment, especially with head injuries. You want someone to evaluate them that night, but you also have to monitor them moving forward. So early diagnosis is important, and it allows you to know as a parent and as an athlete what you're looking at going into the upcoming week.
How important is it, Dr. Burgess, when you get that diagnosis and maybe you have something like an ACL tear or a hairline fracture or something that's a little bit more than just ice and rest, to take the recovery time necessary to completely heal? Because I know what it can feel like if you miss a whole season, or if you miss whatever, you've missed, a big chunk of at least your student athlete experience, but thinking a little bit more long term than that.
Yeah, so I know that I deal with athletes daily, so it sucks. And I tell the athlete, it's fine for you to feel exactly how you want to feel, because it does suck, especially if you're a senior and I'm seeing you after the first game and telling you your season is over. So I think first you have to deal with the weight of the diagnosis. And many times we tell an athlete, oh, just get over it. You're fine. You'll be okay. It's just your senior season, right? But for the athlete, at that point in life, it is daunting for them. So I think they have to be able to mentally deal with that before they can deal with the injury. And then once you have that diagnosis, we come up with a treatment plan, and from there we can move forward. But until the athlete is ready, it's hard for them to grasp, especially when you're dealing with the ACL and a 14 to 15-year-old. And I tell them 9 to 12 months, if everything goes well, we'll get you back to your sport.
And the body can heal.
Right.
The body can heal.
The body can heal, but we have to go through steps
to sort of get there, so you're not right back here. I think your job's so cool, Dr. Burgess. I was telling you, you're like living out my dream, but I never wanted to be like a physician in terms of with sports medicine and all. You got a lot of kids in the car rider line right now, or parents or caregivers, that may have a kid who's interested in medicine but don't know where. What drove you to that like sports medicine area for your career? Yeah,
so I had early exposure. So anybody who has a child who's interested in medicine, get them a mentor, get them out to see what other people are doing. For me, it was an injury in high school. I had to see an orthopedic surgeon. He became my mentor, so it worked out for me. But when you think about sports medicine, it's physical therapy, it's athletic training. We have nurse practitioners and physician assistants that also play a role. And then we have primary care doctors. We have orthopedic surgeons. So people hear sports medicine say, hey, I want to do that, but what do you really want to do? So it's great for that kid to really realize there's a lot of opportunities in sports medicine, and then try to get with somebody to see actually what they do.
And maybe you don't spend the rest of your life playing your sport, which no one does. Athletes do age out. Yeah. But if that's something you're passionate about, you can always align your career to stay within the sport and watching the next generation, or just still being, sort of a part of it. I think that's something I always too enjoyed with sports nutrition, was that you got to be a part of other people's journey of reaching their athletic goals, whether it was a student athlete who was trying to jump from their, high school career to their collegiate career, or if it was a professional athlete that was trying to do something really. You get to be a part of somebody's story in a unique way when you're in that sort of sports world that I think is really cool. If folks want to see you, Dr. Burgess, they may need to go. You mentioned you may need to go through starting with your pediatrician or an urgent care clinic, or they can call and just ask.
Yeah. So I work for the University of Mississippi Medical Center, sports medicine. Call and they'll get you in with me. So I treat children and adults from about 8 to 75, 80. But really, I treat athletes in all different parts of life.
I like that. An 80-year-old athlete. That's going to be me, Dr. Burgess.
That's it. Pickleball.
No. I'm not coordinated enough for that. And the other thing I took from our conversation today, Dr. Burgess, was make sure that you fill out your kids' physical form.
Please.
And look for those trends in your family's health history. Those are the things that are most important to keep your kids healthy and safe. So I love that. Thank you for your time, Dr. Burgess.
And don't ignore nutrition and recovery. Rest. Get some sleep.
Yeah, get some sleep.
Thank you for continuing to support this podcast. If you enjoyed this episode, then please leave a 5-star review. And if you haven't done so, subscribe so you continue to get the updated episodes. Until later, peace.
Hey, time out with the sports doctor. Keep our head right in the game. We ain't never stopping. You are now tuned in. Trust, you don't want to miss. This is where life, sports,